Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on signs and symptoms of physiological neonatal jaundice. This jaundice starts after 1 day or 2 days. So it is never on the same day of the birth. If the neonate has jaundice at the time of birth, it is not physiological jaundice, it is pathological jaundice. Physiological jaundice starts after 1 day or 2 days and it peaks. The symptoms are maximum in 5th day or 6th day, and these are completely resolved within 14 days. In some kids, it will not resolve. Those kids needs intervention. And coming to the signs and symptoms, what happens is due to accumulation of bilirubin pigment, there will be yellowness of eyes, yellowness of entire skin. Urine will be yellow, stool will be yellowish or greenishness, or stool is mostly green and loose, and it is multiple times of stool the children passes. This normally resolves within 14 days. In some kids, it will take more. That's where you need the intervention. When this disease becomes serious, and this is known as kernicterus. In kernicterus, what happens is these bile salts enters into the brain. Once they enter into the brain, it makes the baby dull initially. Later stages, there will be hearing loss, there will be vision loss, there will be entire paralysis of the body, there will be convulsions. Convulsion means fits, and also there can be reduced intelligence, reduced reflexes. All the psychological derangements you can see in this kernicterus. These are permanent damage. You cannot reverse it, but homeopathy has scope in it.
Fidicus Homeopathy